Welcome back. There are lots of names for sun damage: brown spots, liver spots, sunspots, but they all come from the same place, and that is the sun. They can fade, but they don't completely disappear unless they're treated. So today, different options to make them go away and what to do to make sure they don't come back. Dr. Deborah Mangione is the owner and founder of the Wisconsin Vein Center and MediSpa, and she joins us now with more. Great to see you.
Good morning. Nice to see you. Thank you.
Nice to see you too. I think we love being in the sun.
Yes.
We love some sunshine, especially in Wisconsin.
That's exactly right. We had a nice summer.
We had a great summer. Yes, but it shows on our face and especially our hands, I feel like.
It does. Hands and face, legs, arms, any part of the body can really show sun damage. And those are the age spots that we refer to. Also freckles. When a kid is young and they're out in the sun and they get freckles, that's some sun damage to their skin.
And I was reading, because there's a lot of push out there for topical creams.
Right.
And I've heard they can sometimes make them fade, but really to get them to disappear, you need to do something a little bit more proactive.
Right, although some people may be very happy with just getting them to fade a lot. And so those products that are out today are really quite remarkable. There have been tremendous improvements in the chemistry behind them. Some of them are even natural, just botanicals, and they work very, very well. But for instance, we have a whole line, different lines that have produced things for melasma and for sunspots. So for instance, the SkinMedica line has Even and Correct. It's fabulous. They say it works even within 6 weeks for people to see a difference, which is very rapid. Alastin has their A-luminate, and that is also something that can really improve the brightness of the skin as well as you use it. And so that's another really good one. They both will work on the different cells that produce melanin or that then take up melanin. So that brings it to the surface.
Now you mentioned
melanin is the protective pigment that's brown.
Okay. You mentioned melasma.
Yes.
It's sort of in the same sentence with sunspots. So some of the treatments that we're about to talk about, do they work for both?
Yes, they do. Although you have to be very careful with the melasma not to use heat treatments, because that can make the melasma worse. So they're a combination of things, and really, you know, we can do things now where we can use different treatments and procedures to really try to reduce melasma, but it's very cautious.
All right, let's talk about some of these treatments that you have, because there are multiple treatments, different options depending on someone's situation. So the first, there's intense pulse light treatments. I've used this for rosacea, but there are two types that work for sunspots and melasma, right?
Well, there are different treatment settings that we can use. You have to go very, very gently, as I said, for melasma because of the heat that's involved with any of these light treatments.
Okay.
And so, but we use two different types of intense pulse light: advanced fluorescent technology and broadband light. And depending on what the person has and how extreme they want to see an effect, and how quickly they want to see an effect, we may choose one over the other. But they're great, and they work very, very well. Both of them do. The BBL, we have the BBL Hero, which is very rapid in motion technique. So that builds heat very slowly. So that may be more appropriate for melasma. But even any kind of melasma, we have to be very, very careful with intense pulse light. I don't want to just say we can do it.
Okay, so when we look at these before and after pictures, we're looking at BBL here first, which is the broadband light.
Right.
But you're seeing not just those sunspots going away, but the skin looks brighter.
Skin looks brighter. They will build collagen. Some people actually see a tightening after it's been done. They have 3 treatments in a row at monthly intervals, and then we allow them to have maintenance treatments once or twice a year.
Okay.
At a discounted rate.
And there's AFT.
Right, and that's on the arms. And so the arms and the hands are areas that are also very well treated with these devices and can really lead to dramatic improvement in how the skin looks.
Big shout out for rosacea people like me, because that treatment works for rosacea
and
also.
The good thing about intense pulse light is there now have been many studies that have shown that it actually can rejuvenate the skin. It can prevent or really retard aging. So it's a fabulous treatment if you keep up with it.
Okay, we got about a minute left.
Yes.
The next is LaserMD.
LaserMD is a wavelength of laser, 1940 laser, that is used and it is attracted to water. And so we can use it really on any color skin, which is wonderful because we can even treat darker skin tones who also get discoloration and pigment spots that they'd like to have go away. And we can, again, do it from very gentle to a more intense treatment to do whatever we want to help the person get resurfacing of the skin and even out the tone.
And there are plasma treatments. There's
Yes.
Opus as well as Neogen. I remember
Right.
you did Neogen.
That's right. I did a really intense Neogen a little over a year and a half ago, and I really like the result. But it's something, again, that after a couple of years you might want to do another one or do more gentle things. And the Opus is fractionated fractionated nitrogen plasma that we are able to do, so it's a much more rapid healing. But again, these are also things that get rid of spots as well as resurface the skin and improve the quality of the skin and the collagen and elastin and really make the skin healthier as well.
You're having tremendous results. I want to say really quick because we ran out of time. The only way to keep these sunspots away is to use really good sunscreen.
And we have lots of physical sunscreens as well as chemical sunscreens, tinted, non-tinted, but you need a sunscreen.
I wear one now every day, and there's one that your people recommended to me that I absolutely love. You got to do those treatments at home to back up the treatments that you have in your office. Thank you so much.
Thank you
for being here. And I know we're going to share a special offer that you have, and that is that this October, the Wisconsin Vein Center and MediSpa is offering a $100 rebate on either of those Intense Pulse Light skin treatments. They still have a few spots available on their schedule to get rid of your sunspots. So call for a complimentary consultation and see which treatment is right for you. Here's their phone number. It's 262-746-9088. Or for more information, you can visit wimedispa.com.